Like and subscribe and click the bell icon to get new video updates.
North Korea's COVID-19 outbreak. What we know and don't know. North Korea's first reported COVID-19 outbreak is the greatest turmoil to befall the country since its founding more than 70 years ago, according to its leader Kim Jong-un, as the isolated and impoverished nation scrambles to curb the spread of a highly transmissible virus that risks causing a major humanitarian crisis. North Korea reported 15 more deaths and 296,180 new fever cases between Friday and Saturday evening, according to state media KCNA, though it did not specify how many of the deaths and cases were linked to COVID, likely due to the country's extremely limited testing capacity. That brought the total death toll to 42, according to KCNA, and the total number of cases to 820,620, with 496,030 fully recovered and 324,550 receiving medical care. The climbing death toll and surging fever cases come after North Korea said on Thursday it had identified its first ever case of COVID-19, an alarming development for a country with one of the world's most fragile public health systems and a largely unvaccinated population. But given the opaque nature of the regime and the country's isolation from the world, a trend that has only exacerbated since the pandemic, it is extremely difficult to assess the real situation on the ground. Foreign diplomats and aid workers had fled North Korea en masse in 2021 due to shortages of goods and unprecedented restrictions on daily life, making it all the more impossible to obtain information from the country other than through official state media. But North Korean state media reports have been vague, and many important questions remain unanswered, including the country's vaccine coverage and the lockdown's impact on the livelihood of its 25 million people. Here is what we know, and what we don't know about the outbreak. North Korea's borders have been tightly sealed since January 2020 to keep the virus at bay, making the so-called hermit nation even more isolated from the world. It even declined invitations to send teams to compete at the Tokyo and Beijing Olympics, citing the threat of COVID-19. And as new variants began to emerge, it stepped up those efforts, cutting off nearly all trade with China, the country's biggest trading partner and economic lifeline for the Kim regime, with imports from Beijing dropping 99% from September to October 2020. It remains unclear how the virus slipped through the country's tightly sealed borders. When KCNA reported on the first identification of COVID-19 in the country on Thursday, it did not even specify how many infections had been detected. It simply said samples collected from a group of people experiencing fevers on May 8 had tested positive for the highly contagious Omicron variant. By Friday, KCNA was reporting that 18,000 new fever cases and 6 deaths were recorded on Thursday, including one who tested positive for the BA.2 subvariant of Omicron. A fever whose cause cold and TB identified explosively spread nationwide since late April, the newspaper said. On Saturday, KCNA said a total of 524,440 people had reported fever symptoms between late April and May 13. Among them, 280,810 people were still being treated in quarantine, while the rest had recovered. An outbreak of COVID-19 could prove disastrous for North Korea. The country's dilapidated healthcare infrastructure and lack of testing equipment is unlikely to be up to the task of treating a large number of patients with a highly infectious disease. North Korea has never formally acknowledged how many died during a devastating famine in the 1990s that experts suggest killed as many as 2 million. Those who fled the country at the time shared horrific stories of death and survival, and a country in chaos. North Korea has such a limited supply of basic medicine that public health officials need to focus on preventative medicine. They would be ill-equipped to deal with any kind of epidemic. Jean Lee, director of the Hyundai Motor Korea Foundation Center for Korean History at the Washington-based Woodrow Wilson Center, told CNN at the outset of the pandemic. Doctors who have defected in recent years often speak of poor working conditions and shortages of everything from medicine to basic healthcare supplies. Choi Young-hun, a former physician in North Korea who fled the country in 2011, said when he was helping to combat a measles outbreak in 2006 to 2007, North Korea did not have the resources to operate round-the-clock quarantine and isolation facilities. He recalled that after identifying suspicious cases, manuals for doctors said patients were supposed to be transferred to a hospital or a quarantine facility for monitoring. The problem in North Korea is that manuals are not followed. When there wasn't enough food provided for the people at hospitals and quarantine facilities, people escaped to look for